Jess, and as promised, our third installment on adrenal fatigue natural treatments is today. Today, we will go over the natural treatments for adrenal fatigue, including lifestyle, nutrition, supplements, and mind body care. The lifestyle foundations that you should consider is to prioritize 7 to 9 hours of sleep, starting sleep before 11 p.m. to maintain your circadian rhythms or to reestablish your circadian rhythms. Daily stress reduction, meditation, breath work. It doesn't have to be long, it doesn't have to be complicated, but if you engage in it on a regular basis, you'd be surprised how much it will help. Regular wake sleep times, like we talked about before. Gentle exercise, yoga, and walking is good for the adrenals. Heavy duty exercise, unless you're used to it, is a strain on the adrenals. So, what is this doing? These guys are taking the pressure, if you will, off the adrenal glands. Nutrition essentials, just the overview. Prevent hypoglycemia, having frequent high protein meals. Why is that? Hypoglycemia engenders a fight or flight reaction, which is mainly adrenal. It's really multi endocrine, but mainly adrenal. And we are adapted to have a fight or flight reaction once every 6 weeks. If you have hypoglycemia, aside from all the stressors that we're always facing, you're having a fight or flight reaction 4, 5, 6 times a day. That's going to exhaust the adrenals. Try and reduce the stress on the adrenals. Sugar, an over amount of caffeine. We tend to use caffeine to stay awake and to give us energy, and too much alcohol use. And eating adrenal friendly foods. And just a short list: sea salt, bone broth, greens, berries. Okay, not the ultra processed foods that are out there. We talked about foundational treatment last time, but some possible additions to that would be liposomal vitamin C, because the adrenals are one of the few organs that store vitamin C. And notice I said liposomal. With the regular vitamin C, the crystals, which is the powder, you can only really get 500 milligrams in at a time. Putting too much in, you get diarrhea. Liposomal vitamin C, you can have a whole lot more. It gets directly into the cells. Maybe some magnesium, phosphatidylserine, which I'm going to explain on the next slide, electrolytes like sodium, potassium, and adrenal glandulars, which I will explain in about 2 slides down. Now, previously, we spoke about the HPA axis, okay, the hypothalamic pituitary adrenal axis. Remember, when I say something fast, ignore it. Okay, the stimulation of the hypothalamus causes the pituitary to release ACTH, which stimulates the adrenals to release adrenaline, noradrenaline, cortisol, and DHEA. Cortisol goes up to the receptors in the hypothalamus and pituitary to turn off the reaction. That was the Incredible Hulk reference I made last time. Okay, but when this happens a lot, the receptors, look at the hypothalamus on the upper left-hand side. The blue is representing a normally functioning receptor. The green means the receptor is desensitized. In other words, it's not responding to the signaling of the cortisol. When this happens, when we have a lot of adrenal input and a lot of cortisol out there, okay, these receptors get desensitized and don't work, and guess what? The reaction doesn't turn off. So you start getting a constant vortex, a constant reestablishing of the fight or flight reaction, and eventually the adrenals get exhausted. They poop out, if you will, okay? The substance that will help reestablish the receptor function is phosphatidylserine, okay? And you'll see it in vitamin stores as PS, just plain old PS, phosphatidylserine. That would be one of the phospholipids that you could use to help this reset, and then your adrenals have the opportunity to turn off. That doesn't relieve you of the responsibility of getting other things done, but it helps. Adrenal glandulars. Now, I realize that what adrenal glandulars are actual adrenal gland. Okay, that's defatted and, which is lyophilized. That's what defatted means. Okay, and it's pressed into a pill. Okay. Um, and this actually helps rebuild the adrenal glands. Now, like I, like you already know, I've been a doctor for a really long time. But when I was learning, when I was in school, I asked one of the doctors who was uh, instructing us, "Why would I take this? Because it's going to get digested in the gut, isn't it?" And he looked at me with a smile on his face and said, "Jess, I know what you're talking about, and that seems to make sense, and I agree with you, but it does work." And that's why you see it on the market, okay? My recommendation is to take the whole adrenal gland, not just the cortex, because the cortex will stimulate cortisol, and that may not be what you want to do, okay? It's always good to use the whole adrenal gland, and guess what? It'll help rebuild it in association with everything else, the foundational treatment you're doing. Okay, adaptogenic herbs. I'm sure you've heard of these. Things like ashwagandha, which balances cortisol, rhodiola, which boosts energy, holy basil, which is an anti-inflammatory, licorice root, which stabilizes cortisol, and Siberian ginseng or ginseng, which enhances recovery. And you can get these in together in various capsules or take them individually. Okay, but I wanted you to know that these are the kind of things you're looking for. There's also things called adrenal cocktails. Okay, there's two examples of them here. And basically, they are electrolytes. Okay, sometimes the Vitalix contains some of the adaptogenic herbs. Again, I'm only making examples, not specific recommendations, but I wanted you to have some place to go, or some place to look, or a starting point, so you can make decisions for yourself. Mind-body therapies. Okay, these are things like transformational healing breathing techniques. If you were interested in doing something like that, send me an email. I'll tell you where to go. Some people who do this very well. Cognitive behavioral therapies for stress, emotional freedom technique for trauma and stress, EMDR, eye movement desensitization reprogramming. I think I got that right. Okay, for trauma, acupuncture, Reiki. Dr. Jess is a Reiki master. Okay. If you've experienced trauma, significant trauma, EMDR is something you should look for. But let me give you a piece of advice here. Should you find an EMDR practitioner, make sure that they also are a trauma trained practitioner, somebody trained in treating trauma. Because sometimes these things bring up the traumatic event again, and you should be with somebody who knows how to handle that. The emotional freedom technique is also great for trauma. That's the tapping technique, okay, but not as, powerful in bringing out trauma. And cognitive behavioral therapy helps you achieve new behaviors so you don't engage in toxic behaviors. Acupuncture for balancing the energy system in the body, Reiki for the same reason. Okay? There are advanced interventions, things like DHEA supplementation, low dose hydrocortisone, and IV nutrient therapy. Now, some of these things are comparatively powerful, so I would not use them except under a healthcare provider's supervision. IV is obvious because you can't get an IV without a doctor's prescription. But the DHEA, which you could do yourself, and the low-dose hydrocortisone, which there are ways of doing it, I'm just going to suggest that you at least consult your healthcare provider about the use of these because you can overdo it, you can hurt yourself, and I would feel better about it if you spoke with somebody about it. Okay. And these are some references in case you want to look at, where I got these from. Okay, and Titlebound, From Fatigue to Fantastic, Adrenal Fatigue, the 21st Century Stress Syndrome, Why Zebras Don't Get Ulcers, and some of the IFM protocols. The first three are the best to look at. So these are some of the suggestions you can use in specifically treating the adrenals. So to sum up what we've learned in the past 3 weeks, number one, adrenal fatigue is rampant. And it will express as a whole mess of different ways. So you should be considering it as, if you're treating for any kind of condition at all. Okay? Two, what we learned last time was foundational treatment, which review it again. Go back to it because if you treat the foundation of the body, if you treat the cells, everything will start getting better. And that is the stone left unturned, people. That's where traditional medicine and many of my alternative medicine colleagues drop the ball. You need to work on the cells in the way that we spoke of and treat leaky gut syndrome, because remember, the treatment of leaky gut syndrome is not dangerous, it's benign, and most people have it in one form or another. I wouldn't even depend on the testing. Just go ahead and treat it. You can't go wrong. Okay? And now, with after engaging or while you're engaging in foundational treatment, what we went about today is some of the specific treatments for adrenal fatigue, which you can choose one or all, okay, and you'll be doing yourself a favor. So next week, we're going to start talking about thyroid disorders. I would be honored if you told your friends about my YouTube channel. Okay, we're giving out good information. At least I like to think so. By the way, I do this because I love doing it. I love giving you information that you can use immediately and is free. I'm not selling anything, I'm not expecting anything. All I want you to do is be able to advocate for yourself. If you have questions, you can email me at jess@drjessorman.com. If I don't answer you within 24 hours, please email me again because I get a boatload of emails a day. If you were thinking of working with me, go to my website and book a free 30-minute get acquainted call. And I've changed that from a phone conference to a video conference, a Zoom conference. I'll change the slide next time, okay? I found that to be better when I get to face-to-face talk to people. Why would you want to treat with me? Well, I'm very well educated. I have lots of degrees, lots of certifications, and tons of experience, about 5 decades of experience, both in traditional and non-traditional medicine. And I am the type of doctor that will give you the time and empathy you need that is usually not there in a busy practice, or you're not working with the doctor themselves. You're working with someone who associates with them or someone less trained than them. Okay, when you work with me, you work with me. And as always, people, if no one told you that they love you today, remember Dr. Jess does. See you next time.